Hello everybody, I am Dr. Ami Sanghvi from Sanghvi Eye and Diabetes Care Center, Mumbai. Today I am going to talk about diabetes. Diabetes. What exactly is diabetes? We always talk about people having diabetes. WHO has termed this year as the diabetes year. There is a lot of awareness which has been been created among people about diabetes. Today I would like to give you in short brief about what exactly diabetes is about. Diabetes is a disease when the blood sugar levels in our body start rising. What happens is the sugar or glucose is the main source of energy for our body. This sugar is utilized in our body by the cells of the body with the help of an hormone called as insulin, which is secreted by the pancreatic beta cells. Now, when this hormone is not properly produced, not sufficiently produced, or whatever is produced is not being utilized well, leads to an increase in blood sugar levels, and that leads to diabetes. Now, what are the symptoms? What can happen when you get diabetes? The main point to remember here is that 50% of our patients do not know that they have diabetes. 50% of the patients do not have any symptoms and they get detected for diabetes accidentally during any when they go for a regular annual checkup or during any insurance checkup, during any surgery. At this time they may come to know that they have diabetes. But the common symptoms which can occur due to the increase in blood sugar levels are that the patients may feel very thirsty, they feel to pass a lot of urine, especially in the night, they feel very hungry, there is a lot of tiredness, patient feels tired very easily, there can be blurring of vision, there can be a burning sensation while passing urine, there can be tingling or numbness in the hands or legs. If there is any injury or wound, this may not heal easily. These can be symptoms which can indicate that you may have diabetes. Now, diabetes can be of various types. The main types of diabetes are type 1 diabetes, type 2 diabetes and gestational diabetes. Type 1 diabetes generally is seen in the younger age group in children and adolescents, and this can come suddenly. It is generally because of the failure of the beta cells to produce any insulin. These patients do not have any insulin in the body and they require insulin from outside in the form of injections or insulin pump lifelong. This type of type 1 diabetes affects 5 to 10% of our diabetic population. Type 2 diabetes, which is the main type of diabetes we generally see in our population, that is in 90% of the patients, is because the insulin hormone is being produced insufficiently, and whatever insulin hormone is being produced is not being able to work well because either the patient is obese or overweight and has a lot of insulin resistance, or there is a decreased amount of physical activity. Generally, this type of type 2 diabetes is seen in an elderly age group, but nowadays we are seeing it even in younger patients, even at the age of 20s and 30s, because of the lifestyle we lead. The third type of diabetes is gestational diabetes. Now, this diabetes occurs only during pregnancy. These females have diabetes only during pregnancy. They do not have diabetes before and after pregnancy. But if the blood sugar levels are higher during pregnancy, it can lead to a lot of damage to the mother and the baby also. Again, gestational diabetes can indicate that the mother or the baby can have diabetes later on in life. Now, who are the people who are at risk of developing diabetes? The high-risk patients who have a high risk of developing diabetes. Type 1 diabetes, generally no one can predict who can get. But for type 2 diabetes, it is that if you have a family history, that one of your family member, either your parents or your sibling has diabetes, there is a lot of chance that you may develop diabetes. Again, if you are obese or overweight, if your weight is on the higher side, then there can be chances of developing diabetes. Any person above the age of 40 should get an annual checkup done, because that in your annual checkup also can we know that increasing age can lead to more chances of diabetes. If you have blood pressure or any cholesterol problem, this again leads to increase in chances of diabetes. If your work profile is sitting profile where you're not, the physical activity is very less, the diet is not controlled, that can also lead to chances of diabetes. Now, how do we diagnose? How do we come to know that a patient has diabetes? There are various methods to come to know that the patient has diabetes. One is that you do a fasting sugar level where you are fasting for around 8 to 10 hours in the night and then go and give your blood sample. Now, if this blood sample shows a blood sugar of more than 126, then this is diabetes. There is one more important test which we can do in our patients, which is called as to diagnose diabetes, which is called as oral glucose tolerance test, in which the first sample is collected at a fasting level and then the patient is challenged with 75 gram of glucose, and again the blood sample is collected after 2 hours. Now, if this blood sample shows a value of more than 200 after 2 hours, it is diagnosed that the patient has diabetes. There is one more test called the HbA1c test, in which we can find out that the patient has diabetes from some time, that is last 3 or 4 months. These are the different ways which we can diagnose if the patient has diabetes or a pre-diabetic. Even in pre-diabetic, in our population around 70% of our population is pre-diabetic. So we have a huge burden on us to control these patients also, so that they do not become diabetic later on, because once you are a diabetic, you may need lifelong medications. Now, coming to how to prevent diabetes. If you have pre-diabetes or someone in your family is having diabetes, how can you prevent by not having diabetes? The main thing is diet control. Diet include a lot of complex carbohydrates in your diet, less amount of fat, more amount of fiber in the form of vegetables and fruits. Prefer a fruit instead of a fruit juice. Also, take small portions at one time. Do not have heavy or large meals at one time. Walking or any form of exercise, physical exercise, also helps in preventing diabetes. Do not sit in one place for long hours. After every 20 to 30 minutes, try to get up from your seat, walk for 10 minutes and come back to your seat again. Avoid alcohol. Avoid smoking. If we take care of these small lifestyle changes, we may be able to push diabetes and may not get diabetes on a long term. Now, there are patients who come and ask us, can diabetes be permanently cured? The answer is diabetes can be kept under control, but unfortunately it cannot be permanently cured. If your doctor has prescribed you certain amount of medicines, kindly continue taking them. If your sugars are coming in normal range because of the medications, please do not stop the medications. Consult your doctor and then reduce or increase the dose of your medications as prescribed by your doctor. Do not self-treat when you are treating diabetes. Lifestyle modifications forms a lot of important factor in treatment of diabetes. So as I said earlier, regular exercise, diet in the form of including a lot of fiber in your diet, cut down fat, include proteins in your diet, include complex carbohydrates, hydrate yourself well, take good amount of fluids, eat every 2 or 3 hours, do not go hungry for more than 3 hours at a stretch, include a fruit in your diet, avoid fruit juices in your diet, and regular walking, brisk walk, swimming, whatever suits you for around 30 to 45 minutes a day is definitely helpful in addition to your medications to keep your sugars under good control. Because if we do not keep our sugars under good control, the sugars, if they are on a higher side and if you have a long-term diabetes, can lead to a lot of complications. The complications of diabetes can include many organs in our body, like the heart, the eye, the kidney, the nerves, the peripheral circulation, the arteries. So there are the complications which can develop due to diabetes are that there can be an heart attack, there can be stroke, there can be something called as diabetic retinopathy, which can cause decreased or loss of vision, something called as diabetic nephropathy, in which the kidneys fail and the patient may require dialysis and end stage may require a renal transplant, that is kidney transplantation. There can be gangrene and amputation of the foot if the sugars are not under good control. So if the patient takes care of his sugars well over a period of time, these complications can be prevented. Now, how do we prevent these complications? There are three major things which we need to take care of. That is A, B and C. A is the A1C, that is your HbA1c. The average sugar control should be good. It should be around 7 to 7.5 to prevent long-term complications. That is basically your sugars should be under good control. Secondly is B is blood pressure, that if you have blood pressure, take your medicines on time and keep your blood pressure under control. C is cholesterol. If your doctor has advised you to take cholesterol medications, kindly continue them and keep your A, B, C under good check. Sometimes diabetes can have emergencies also, and these emergencies can be life-threatening. There can be sudden increase in blood sugars if you have stopped your medications or not taken medications on time, and can lead to something called as diabetic ketoacidosis, which can lead to a comatose stage and patient may need hospitalization due to high sugars. Another medical emergency which we see in our diabetic patients, which is generally low sugars. If the low sugars are mild, they can be treated at home itself with taking additional sugar and reducing the dose of medications in consultation of your doctor. Generally, low sugar or hypoglycemia occurs when the patient has taken medications and skipped meals, or the patient has taken medication and not eaten enough, or the patient has taken increased dose of insulin or medication by mistake. This leads to a sudden drop in sugar. Now, when a patient gets low sugar or hypoglycemia, what are the symptoms? The patient may experience giddiness, there can be palpitations, the patient feels very hungry, disoriented. At this time, if the patient consumes sugars, his sugar levels come back to normal. But if this is not taken care of, the sugars still keep dropping and it may require an additional help from a family member, and in worst case scenario may require hospitalization. If you are experiencing low sugars, every now and then consult your doctor, because a doctor will help you to reduce your dose of medications and get your blood sugars back to normal again. Now, there are common questions asked about fasting. Can we fast when we are on diabetes medicine? I would advise avoid fasting and feasting if you are on treatment. Occasional fast is okay, but long-term fasting definitely should be avoided if you are on treatment of diabetes. This fasting also should be in consultation with your doctor, because your doctor will help you to reduce your medicines, advise you what to do during fasting, which medications can be allowed during fasting, follow the doctor's instructions during fasting, and then this fasting or religious period can also be a safe period for you. So, concluding my talk, diabetes is a major problem because India is termed as the diabetes capital of the world. But if we take care of our sugars, we monitor our blood sugars regularly, we walk or exercise regularly, we follow our diet, we take our medications on time, and regularly consult our doctor at least once in 2 or 3 months, then we can keep our blood sugars, our blood pressure and our cholesterol under good check and prevent long-term complications with diabetes and lead a happy and a healthy life even with diabetes. Thank you.